Welcome to Mentally Healthy. We're so glad you're here. We are very proud to welcome and introduce Innovative Products as the sponsor for today's video and content. IPP supports the ongoing mission of Mentally Healthy and our affiliations. As Innovative Products' tagline outlines, Mentally Healthy honors discovering the possibilities together.
Let's take a moment to relax and breathe. Today, we're going to learn and explore 10 tips for enhancing obsessive-compulsive disorder (OCD) treatment. Obsessive-compulsive disorder (OCD) causes people to have recurrent unwanted or unreasonable thoughts or sensations, which is obsessions, or make them feel driven to do something repeatedly, which is commonly referred to as compulsions. Common obsessions include fear of germs, while common compulsions include wanting to keep things in a particular order. If a compulsion cannot be accomplished, a person with OCD tends to become anxious. Just like with anxiety, obsessive-compulsive behavior should only be considered a disorder if it causes difficulties in life. A low level of obsessive-compulsive behavior can be helpful. For example, if a person worries that they might not have turned off the stove and double-checks it once, this would help keep them safer. On the other hand, if a person cannot proceed with their daily tasks without checking the stove multiple times, the situation can be considered a disorder. Similarly, accountants who double-check their figures once or twice are more accurate in their work. However, if they have to check many times, they are dealing with OCD. With those things in mind, let's explore the following 10 tips for enhancing obsessive-compulsive disorder (OCD) treatment in those that truly suffer with this condition. If you're ready, let's get started. Number 1. OCD operates in a vicious cycle. Antidepressant drugs are often prescribed for the treatment of obsessive-compulsive disorder, but obsessions and compulsions may also respond to cognitive behavioral techniques, or to a combination of both antidepressant drugs and cognitive behavioral techniques. The most effective cognitive behavioral technique for compulsions is to delay responding to your urges and then to distract yourself from the resulting tension and anxiety. Try to ignore your urges for longer and longer periods so as to that gradually get desensitized to the discomfort that this arouses. In so doing, you are basically short-circuiting the vicious circle that is at the heart of obsessive-compulsive thinking. This diagram represents the vicious circle that takes hold in obsessive-compulsive disorder and that you must be familiar with. Negative thoughts such as anger and guilt merely reinforce the original obsessional thoughts, feeding into the vicious circle. As explained earlier, you can break the vicious circle by ignoring your compulsive urges for longer and longer periods so that you gradually get desensitized to the discomfort that they arouse. Feeling tired or stressed, for example, because of a difficult relationship or a tight deadline, can aggravate your obsessive-compulsive symptoms, and ignoring your urges is going to be more challenging in these circumstances. So, although you can expect to make progress, you are likely to have both good days and bad days. Do not feel discouraged by the bad days, try instead to identify the stressor and then to avoid, address, or minimize it. Number 2. Try using an anxiety ladder. Sometimes it can be helpful to devise an anxiety ladder, which involves ranking anxiety-provoking situations from least feared to most feared. Begin by exposing yourself to the first rung of your anxiety ladder and delay responding to your urges. Once you feel relatively comfortable with the first rung, move up to the next rung, and so on. Monitor your anxiety level as you delay responding to your urges, for example, by rating it on a scale of 0 to 10. After some time, your anxiety level should naturally begin to fall off. Sometimes it may seem impossible to prevent all your urges. If this is the case, try to gradually reduce the time that you spend carrying them out. For example, if your urge is to check the stove 10 times, try to check it only 5 times. Number 3. Try managing obsessional thoughts. In some cases, an obsessional thought or image may lead to a compulsion to have another thought or image so as to neutralize it. A useful strategy for dealing with this is to stop fighting the original obsessional thought and simply to accept it, however unnatural or difficult this may seem. Everyone has thoughts that can be unnatural, immoral, or violent, They are just thoughts, they do not make you a bad person. If you try to not think about them, they only become more present in your mind. To illustrate this point, try this now. Try not to think about a pink elephant. Paradoxically, the only way not to think about a pink elephant is to actually think about one. Number 4. Focus on the positives. Try to remember to feel positive above your achievements, however modest they may seem. Some people who resist their urges fall prey to negative thoughts. For example, they may feel guilty for putting their loved ones at risk by not checking the stove enough times. Such negative thoughts need to be identified and countered with reality testing. An example of reality testing is to think to yourself, most people do not check the stove 12 times. Number 5. Hypnosis for OCD. There are few published studies about the effectiveness of hypnosis for OCD. However, studies have shown in some cases, hypnosis appear to be helpful. Since the mainstay of psychological therapy for OCD involves learning to cope with anxiety caused by evading a thought or behavior related to the OCD, the hypnosis techniques to help relieve OCD are similar to those used in treating anxiety disorders. Patients can be taught to calm themselves by imagining that they are in their favorite place that brings them happiness. They are coached to imagine what they might experience using all 5 senses to intensify their relaxation. Patients are then instructed how to trigger their relaxation response when dealing with OCD-related anxiety. Some patients can imagine placing their anxiety in a helium balloon and letting it go. The further away the balloon travels, the less anxiety it can feel. Another hypnotic metaphor that is especially apt for obsessive thoughts is to observe them as if they are clouds in the sky that float by, rather than interacting with the thoughts. Patients can be coached to take deep breaths using their diaphragm, which prompts their abdomen to expand with each inhalation. Such a breathing pattern for several breaths calms the mind and body by releasing calming body chemicals. Also, focusing on breathing can help distract the patients from their anxiety. Hypnotic metaphors that help teach such a breathing pattern include imagining a sailboat at the lower tip of the breastbone that rises with each inhalation, or imagining the belly button is tied to a yo-yo string that rises each time a facilitator raises their hand in correspondence with each inhalation. A hypnotic state can be used as a forum in which patients can rehearse imagined exposure to triggers of their OCD as part of exposure response prevention therapy. For patients dealing with obsessive negative thoughts for which they seek reassurance from their family members or peers, it can be very helpful to teach them how to interact with their subconscious through hypnosis. Patients can then be encouraged to ask themselves for reassurance rather than relying on others. For example, a boy who consistently asks his mother whether he will become sick can learn to calm himself by hearing reassurance from his subconscious. Through hypnotic age regression, patients can imagine the very first time they develop their obsessive or compulsive behavior. Patients then can be coached to imagine addressing the trigger of their behavior at the time of its inception, which can help prevent its perpetuation. Number 6. Try using an anchor code. Root causes of obsessive compulsiveness are complex and often deep-seated. Possible underlying emotional states may include the fear of the unknown, fear of negative outcomes, fear of not being in control, fear of failure, fear of rejection, shame, or embarrassment, and the fear of annihilation. In the great majority of cases, obsessive compulsiveness is one's anxiety, based on irrational thinking, rather than reality influencing behavior. In cases of severe obsessive compulsiveness, seek medical and mental health professionals for support. When you find yourself ruminating or obsessing over an activity, give yourself an anchor code to stop the negative pattern and provide control and security. For example, if you feel the need to wash your hands several times unnecessarily to be sure they're clean, simply wash your hands once or twice, notice that they're already clean, and say to yourself the anchor code, which can be a word or words such as clean, good, good enough, done, check, success, complete, secure, or anything else that provides a strong signal, knowing that every time you give yourself this code, the situation is under control, and it's okay to go do something else. A good anchor code interrupts an obsessive thought pattern and provides fact-based security for new action. Number 7. Non-drug treatments, glycine and sarcosine. Glycine and sarcosine are two amino acids that have been investigated as potential treatments of OCD. Reports show glycine affects glutamate but via an indirect mechanism of action. Sarcosine acts as a co-agonist at NMDA receptors, which play an essential role in the brain's glutamate signaling. In a small 12-week placebo-controlled double-blind study, 24 adults with OCD were randomized to receive glycine up to 60 grams per day versus placebo while taking their usual OCD medications. OCD symptom severity was self-rated using the Y box at weeks 4, 8 and 12. Only 14 individuals completed the study due to a high dropout rate caused by poor side effect tolerance, namely bad taste and nausea. 2 individuals in the glycine group experienced significant reductions in OCD symptom severity, but no one in the placebo group improved. A larger study is needed to investigate the potential role of glycine as a viable treatment of OCD. Number 8. NonDrug Treatments, Porridge Extract. The dried flower of the herbal Echium, also called borage or star flower, is widely used in traditional Persian medicine to treat anxiety and depressed mood. The bioactive constituents of borage extract are known to affect serotonin activity in the brain. In a small 6-week double-blind study, 44 adults with OCD were randomized to receive an aqueous extract of borage 500 mg per day or a placebo. Individuals treated with the borage extract reported reductions in symptoms of both OCD and generalized anxiety that were significantly greater than the placebo group. Some individuals treated with borage extract reported headaches. It is important to note that some over-the-counter preparations of borage contain bioactive agents that are known to increase the risk of cancer, for example, the pyrrolizidine alkaloids, hence caution should be exercised when selecting a brand that is both reputable and safe. Number 9. Finding safe, reliable natural product supplements. As natural product supplements are not regulated in the United States and many other countries, finding affordable quality products that are safe for human consumption, contain the desirable active ingredients in appropriate strengths, and have good bioavailability poses complex challenges. Efforts are currently ongoing to address issues of natural supplement quality and safety, including by a non-governmental organization called the U.S. Pharmacopeal Convention and other organizations. In sum, the evidence supporting the use of the natural products reviewed in these non-drug treatments of OCD should be viewed as preliminary, and are shared to you for awareness and not recommendations. Large, well-designed placebo-controlled studies are needed to elucidate the potential clinical benefits of natural products for OCD and related disorders such as trichotillomania and compulsive nail-biting, and to determine appropriate, safe dosing strategies when a particular natural product is used alone or as adjunctive to conventional drug therapy. Number 10. ERP is a frontline treatment for OCD. Exposure and response prevention, ERP, a behavioral therapy under the CBT umbrella, is the frontline treatment for OCD. This entails facing one's fears head-on through exposure and eliminating compulsions performed. Therapy should be behaviorally oriented, as one's response to obsessions, compulsions, is the crux of the problem. We are not in control of what pops into the mind, obsessions, but are in control of what we are doing in response to them, compulsions. Compulsions reinforce obsessions as important and dangerous, when they are unimportant false alarms, and reinforce the false notion that the only way to manage obsessions is to carry out compulsions, and people with OCD get trapped in a debilitating cycle. This concludes our video on the 10 tips for enhancing obsessive-compulsive disorder, OCD, treatment. Remember these basic key points when learning how to control anxiety in connection with OCD. Obsessive-compulsive behavior should only be considered a disorder if it causes difficulties that consistently affect daily life. Common treatments for OCD include cognitive behavioral therapy and antidepressants. Hypnosis methods for OCD can involve calming visualizations, breathing, and self-soothing. We hope you find today's advice helpful, but if you are still struggling, then do consider getting enrolled on a formal cognitive behavioral therapy, CBT, program or some other form of therapy. Please share with us your experiences in this area. If you or someone you know are experiencing symptoms of obsessive-compulsive disorder, please know there is help. Finding a therapist who truly specializes in the treatment of the disorder and understands how to treat it effectively is an important next step. Your friends here at Mentally Healthy support the American Psychological Association for finding a good therapist and ensuring you work with a qualified professional who has background and expertise that will benefit you and your specific needs. We are not affiliated with that organization and receive no special compensation for recommending them. We just recognize the importance of finding qualified professionals to help us when help is needed. Another great resource is also available for those that can take advantage of it. For all our viewers that reside in the United States, a hotline is available to act as an immediate response lifeline center for all suicide and crisis events. Just call or text the number 988, local rates may apply, to immediately be placed in touch with someone you can talk to. If you are an U.S. veteran or military service member, you may text the U.S. Veterans Crisis Line directly at 838-255. Both of these resources will also be placed in the description area of this video. Use these trusted resources as needed.
Well, that's all for today. Thanks so much for joining us at Mentally Healthy. If you've enjoyed our video, please like it, and consider subscribing to our channel, as we have lots of great new content in store for you. Subscribing, liking, and clicking the notification bell keeps you connected to us, and truly helps our channel grow. Here's a few other great videos from our channel you can visit right now. Until next time, stay mentally healthy.